Hello, everybody. Welcome to the Vibrant Health Show. I'm Dr. Shannyn Pearce. Today's a really detailed topic. So as I was collecting all of my thoughts, I realized this is probably going to have to be a two-parter because I have a lot to say about birth control and hormones and all the things that go along with that. So buckle up. We've got a lot of things to go over. I'm going to open my comments. If you guys have comments as we go, I'll come back and get as many questions as I can, or if you're watching the replay, feel free to ask questions and I will come back and check those. But let's get started with the birth control topic, which I know is a very heated, sometimes controversial topic. So I want to hit all the things, right? I think you guys need your questions answered. You need to know alternatives, and you need to know what you can do, not only for contraception, but balancing hormones, because unfortunately, we've been told for a very long time, and I was put on birth control at 14 to help regulate cycles and for acne, like a lot of young girls are, and was on it a large part of my life and had truly no idea that it actually had negative side effects, some of which are not reversible, right? There are permanent changes that makes to our body, and we are not told these things before we're put on them, or we're not told these things before we put our young daughters on birth control. So I want to make sure you are well educated so you make the best choices for your body or the body of the young women who need that information as well. So no judgment, right? Like I've been there too. I was put on birth control. I didn't know these things. So the statistics right now are over 100 million women worldwide are on birth control, but half of them are on birth control, not for contraception, but for hormone related symptoms. Okay. This is what the majority of today's talk is going to be about. If you are put on birth control or have been told that birth control is the thing that is going to balance your hormones, that is a complete load of crap, because birth control does not balance your hormones. In fact, it destroys your hormones. And sometimes, yes, it could help with some symptoms. So common things are putting women on birth control for: heavy periods, irregular periods, acne, PCOS, endometriosis, to really help minimize maybe some of the discomfort, pain, heaviness of those cycles. And in the short term, for some women, it does help. For a lot of women, it doesn't help at all, and they feel terrible on birth control. But yes, for some women, it does help the symptoms. But the problem is they are using very potent synthetic hormone to squash symptoms without correcting the underlying cause, which means whatever was causing those hormonal symptoms in the first place is still there, and it's continuing to create damage, is continuing to imbalance your natural hormones, and you're not fixing the problem. So if ever you decide to come off the birth control, or once the birth control stops working so well, these things are going to come back with a vengeance, and you're going to continue to have more and more health problems because of it. So my biggest issue with putting especially young women, and when I say young women, I mean like 30 and under, still having hormone fluctuations, still in the prime of their conception years, putting those women on birth control, you are creating long-term imbalances that could be pretty simply corrected with more natural measures. Yet, we're never given the option, right? If you watch my stuff often, you know I'm all about giving you the options. You make the choice. You choose to go the medical route, fine. I support you and love you either way. But I believe women deserve options and to know both sides so that you can make the best educated decision and not be told that it's birth control or bust. Because truly, up until just recently, that's pretty much the only answer most women have gotten when it comes to hormone imbalance. So if you have been on birth control or it's been suggested for you for symptoms, hormonal symptoms specifically, we're really going to dive into that today. We're going to talk about what birth control actually does to your hormones, what it does to the other areas of the body, what side effects it's creating long-term for you. That way you also know if you are currently on birth control, hormonal birth control, or have been on it in the past, there's some things you need to work on, right? There's some things you need to fix because of these known side effects. I'm also going to talk about alternatives, and then we're going to start talking about how we can naturally fix some of these things, but looking at how much information I have to get through today, that might be a part two. So hang in there. See lots of people jumping on. I'm going to come back and see some questions as we go. Let me just check a few questions real quick. Yes. Put on to regulate your cycle. We're going to talk a lot about that today. So let's talk first of all about how birth control works, because truly until I actually started researching some of this stuff for my own self, I had no clue really how it works. And people will say, well, it's because we have these hormones and it's giving us the right balance of hormones in our body, so our cycles get better. That is not true at all. So the way that birth control works is they put synthetic, and really truly most birth control is the crappiest version of synthetic hormones, right? There are some cleaner, better ones, but most birth control is not that. So you're getting these synthetic hormones and they load your body with it so that your brain hears, oh, we have a ton of hormone, and it stops making your own hormone. That right there, knowing that the purpose of birth control is to stop your brain from communicating to your ovaries and your uterus and making its own hormone, that right there should scare you. Because anytime you tell your body to stop doing something and you give it a bunch of synthetic stuff to do it for you, eventually that system, that innate system in your body, is going to forget how to do it, or it's going to get lazy, which means when you try and come off birth control at some point, your brain no longer remembers how to properly make these hormones because it hasn't had to do it for years, if not decades. So it fully shuts off that proper communication from your brain to your ovaries, to your uterus, and to your thyroid. We're going to talk a lot about that today. Rarely does anyone talk about the implication that birth control has on thyroid function, but it's major. And it's one of the reasons we get a lot of long-term issues when we've been on hormonal birth control. So number one, it shuts down your body's ability to make hormones. That is going to be something you have to heal from long-term once you decide to come off of that birth control. When I test a woman who's on birth control, so I get a lot of people who come to work with me and my team who want to get off birth control. And we'll talk a little bit today about that's a process, right? You want to do it properly. But I'll test their hormones at first. I just kind of want to see how is their body adapting to the birth control, right? Knowing that it's not going to be the cleanest test, it's not going to be the best pattern. But I'm always curious because everybody is going to take those synthetic hormones differently. And let's say, so I just had a 21-year-old lady, she wants to get off birth control. She wants to preserve her fertility. She knows she wants to have a family one day. She's researching birth control. It's freaking her out. So our job is to help safely have that happen for her over these next couple of months. She's 21 years old. I test her hormones. They are all the way down in menopausal range. Menopausal range, that's a very limited amount of hormone in the body for a 21-year-old female because she's getting a bunch of other synthetic hormone. But her actual true hormones are so low that now this 21-year-old girl is having symptoms of menopause. She's having brain fog. She's having bloating. She's gaining weight. She can't figure out why. She's having massive mood issues, all because her actual body feels like it's in menopause, even though she has all these synthetic hormones regulating a cycle. So just because you might have a cycle at the right time when you're taking birth control does not mean, and it's actually, you are not actually having a normal cycle. There's a very big difference between your body naturally having a cycle from the proper ebb and flow of hormones. You shed the uterine lining, you have a proper cycle, to what is called a pill bleed. Your body is forced into bleeding for a few days of the month, or if you're on an IUD, you might not even be at all. That is a very different physiological response, and it is not natural, and you're not getting the same health benefits you get from having a true natural cycle. So hormone balance from birth control is non-existent. I fully believe there's not a single woman on the planet who actually gets her hormones balanced by taking birth control. Short-term symptom relief, sure. And listen, I get it when you're miserable, when you have heavy periods, when your PMS is terrible, anything that's going to relieve that sounds very tempting, right? So I totally understand why people do it. And in the short term, fine. But make sure that we're finding long-term fixes, we're finding the cause, and we're really making that balance, because over time, it's a disaster hormonally to stay on birth control. So let's dive into that a little bit deeper. So we know right off the bat, it squashes your natural hormones, it disrupts communication in what's called your HPA axis, which one of my favorite topics is called the women's health trifecta, which is your hormones, your adrenals, and your thyroid. Well, birth control disrupts that entire cycle of communication. So that right there makes it a non-starter for me. But there are lots of other areas of the body that you might not realize get directly affected when we take hormonal birth control. Number one being your gut microbiome. There are a lot of research studies out there showing that using hormonal birth control, both IUD or the pill, disrupts your natural gut microbiome. And by this point, you guys probably know how important your microbiome is to all areas of your health. When birth control disrupts your natural flora, the good balance in your gut, it opens up this gateway for you to get all of the imbalanced overgrowths, things like yeast and bacteria. It even makes you more prone to parasites and other infections because it makes an environment where these opportunistic bacteria and yeast and pathogens can thrive. So a lot of women who are on birth control are living in this chronic state of inflammation from these overgrowths in their gut. Now, once that happens, you start to get the systemic effects because your gut helps with neurotransmitter balance for mood. It helps metabolize the abnormal estrogens out of your body. So if it can't do that, the birth control is building up in your tissues and creating inflammation. It's going to affect digestion. It's going to affect your ability to have healthy bowel movements. It's going to affect immune system function. All of those things happen because the birth control is creating the imbalance in the gut. So gut health is incredibly important, and we're actually going to do several sessions on that over these next couple of months as well. But a lot of people don't realize how much being on birth control is going to disrupt your microbiome. And then from there, they wonder why, oh, when I'm on birth control, I don't have a lot of energy. I'm gaining weight, my mood's off because of what's going on in your gut, right? That's probably the number one reason people have side effects from the birth control pill is because of what's happening in their gut microbiome. So being a holistic doctor, the gut microbiome is key. So let alone that it just squashes your natural hormones and stops communication, the fact that it then also disrupts your gut function, those are two really big no-nos for me, right? Those are hugely important aspects of what it takes for a woman to look and feel her best. And right there, we already have disruption in both of those areas. But there's more, right? I feel like a birth control infomercial, the opposite of birth control infomercial. So we have the hormone disruption, we have the gut disruption, but let's talk about thyroid. A lot of you guys are here because maybe you're on thyroid medication. Maybe you've been told you have thyroid issues. Maybe you feel like it's your thyroid, but your labs keep coming back normal and you're frustrated and you don't know why. If you've been on birth control in the past, or if you're still on birth control now, remember, no judgment, we can help make decisions, but it directly impacts your body's ability to absorb your thyroid hormone. So to not get too sciencey, one of the things that birth control does to help regulate, right, I say that loosely, your cycles is it increases there's things called binding hormones, binding proteins. So there's your sex hormone binding globulin and there's your thyroid hormone binding globulin. These are things that carry your different hormones and your thyroid hormone to the cell so they can be used. Well, what birth control does is it makes your body produce a whole lot more of those binding globulins, both for your sex hormones, which is estrogen and progesterone and testosterone, but also for your thyroid hormone. For the purpose of your body wants a lot of these when you're on birth control. They want a lot of these things circulating around. So your brain hears, whoa, we're full, right? We have a ton of hormone. We have a ton of hormone bound to these carrier proteins. We're good. Like, we don't have to make any more. That's the way it works. But what they don't tell you is it's going to work the same way for your thyroid hormone. So now there's two circumstances, right? Maybe you're not on thyroid hormone, but you're on birth control. So the natural hormone your thyroid's actually making is getting all caught up in these binding proteins. So you can't use it properly. That happens a lot in people who their labs keep coming back normal. Your thyroid labs look okay because technically you are making enough thyroid hormone, but it's all stuck on this protein. So you still feel crappy, right? If you still have the constipation, weight gain, digestion, brittle hair, all the signs of thyroid problems, but they're telling you your labs are fine, it could also be that all that hormone's just stuck and you're not using it properly. The same thing goes with your sex hormones. They all get bound up. So you might take some labs and they show okay, but your body's not using them properly. So the fact that being on long-term birth control is going to continue to force your body to make more of those binding globulins, you are directly impacting thyroid function. And just like with your hormones over time, if your thyroid feels like it doesn't have to make a whole lot of hormone for years that you're on birth control, it's going to start to get lazy, which is why we often see there's something called post-birth control syndrome. When you come off birth control, we often see the onset of the first signs for hypothyroidism or Hashimoto's when women come off of birth control, because it's directly affecting it. But no one tells us this stuff. Nobody told me. And I ended up with hormone imbalance and thyroid issues and all this junk that I do tie back to more than just birth control, right? There's always causes, and we'll talk about that. But certainly in my formative years, being on birth control for so many years, when my body should have been learning how to balance, learning how to self-regulate, I definitely made my journey to healing a whole lot harder by not knowing that these things were directly impacted. So we have hormone impact, we have gut impact, we have thyroid impact, and then we have absorption impact, which I'm seeing all over the place now. People are showing up with these really crazy inabilities to absorb certain nutrients and deficiencies in certain nutrients. And now looking back, we're confirming, again, through lots of research and studies, that birth control is known to deplete very just huge amounts of nutrients and minerals. In particular, your B vitamins, which are essential for so many functions in your body. Antioxidants, which is an anti-inflammatory and natural detoxer in your body. It just rips your body of antioxidants, creating massive inflammation. Zinc, selenium, magnesium, these are all things that we know birth control depletes, partly because it disrupts your microbiome, so you're not absorbing as much in the gut as you should, but partly because of just the mechanisms of action. The birth control, the hormones in the birth control will deplete you of those essential nutrients. So that's one of the things that if you're still on birth control, maybe you're thinking about how you can come off of it, or you're not sure, you're researching. One of the things you absolutely must do right away is make sure you're repleting your body with the things that we know that birth control tends to deplete. One of my favorite supplements for that is called Vibrant. So it's actually my beauty support. But the reason it's great for birth control is because it's full of all of the minerals, the B vitamins, the antioxidants that also make your hair, skin, and nails glow, but will protect you from what you're being depleted from with your birth control. So if you're newly off birth control or you're still on it, I would absolutely immediately add Vibrant to make sure you're getting quality nutrients while you decide if and how you're going to come off birth control, which I highly suggest. But being very careful, because we know we're going to be depleted. And that is something that can also become a long-term side effect, right? Everything that I just mentioned, the gut, the thyroid, the hormone disruption, those are things that if not properly taken care of after you come off of birth control, can become long-term, lifelong imbalances, leading to infertility. The next point that we're going to talk about, increased risk of cancers, leading to massive hormone imbalance, leading to early menopause. Like there's so many things that these imbalances post-birth control create later on in life that I also don't feel like we're necessarily connecting the dots with, right? By the time we hit early menopause, we're not thinking I was on birth control when I was 20. We're thinking something's wrong now, but it's what sets you up to have the imbalances that create those other issues over time. And that's one of the reasons why I'm so adamantly opposed to birth control, is because there's a lot of things that really can alter the trajectory of your health for the rest of your life when we're on it for a long time. Now, I also don't want that to scare you, because I know if you're on birth control, or you have been, or maybe your daughter's on birth control and you're thinking, oh my gosh, like it's going to affect me forever. This is so scary. I will also make sure that we teach you plenty of things you can start doing to protect and support and minimize that risk. It's just really important for you guys to know what you're getting into when you make those choices. Which brings us to point 4, which is your increased risk of cancer. This is well documented, right? This has been in the side effect list of birth control for many, many years. So they know your risk of breast cancer, uterine cancer, liver cancer. There's certain cancers that we know we have increased risk of because of the hormones that we're exposing our body to for so long that are not natural, which means our body doesn't know how to properly process them. So it tends to store them in these tissues, and the reproductive and the abdominal tissue in particular is where we tend to store the excess estrogens from birth control, leading us to a higher cancer risk. In addition to that, higher risks of stroke, of heart disease, because again, having that much estrogen, synthetic estrogen, put in the body at a young age, that's going to build up in that, just the arteries and the blood vessels, and being really careful with that increased risk of any type of stroke, and those types of things are very, very scary, very, very serious. So being able to minimize your risk for that by not being on birth control long-term is incredibly important. And then lastly, just overall function, right? I feel like I talk to so many women who are like, I feel terrible when I'm on birth control. Now, every once in a while, that's not the case, right? Some women tolerate it better. We call it the bucket effect, right? If you have less things going on, you might be able to tolerate that. But if you're the woman who already had adrenal imbalance, you have gut dysfunction, you have inflammation, you have all of these things, and then you add birth control on top of that, I feel like a lot of women just feel like, I feel heavy, I feel sluggish, my brain function, brain fog is a really big one, just feeling lack of motivation when they're on birth control, just not feeling like themselves. And I think that has a lot to do with all the other things that we just touched on. Your thyroid's low functioning, your hormones are squashed, your gut balance is out. No wonder you don't feel good. And I also want to say, if you're on a healing journey and you've made a lot of great changes, but you still feel like you're really struggling, really looking at what things am I still taking? What am I on? What things have I done in the last decade that could be making my journey go a little bit slower than I'd like it to be? And birth control is one of those things that can definitely hold that back or make it a little bit longer, right? Not that it's not doable, not that you can't be perfectly healthy, but knowing, especially if you were on birth control for many years, it is going to make your process a little bit slower. And that's okay, right? It's just realistic expectations. Know what you're getting in for, and you're committing to the long haul, right? If you've created all of these imbalances over time, it is also going to take time to rebalance them. In fact, the research shows that coming off of birth control, a minimum of 4 to 6 months before we start to get as much of the birth control out of the body as possible. But really, for a lot of women, it's up to 18 months, if not more, before the body really gets back to proper communication from your brain to your ovaries and your uterus. So don't expect it to be, hey, I'm off at 6 weeks and everything should be back to normal. For a lot of women, that's not what happens. Which brings me to my next topic, which is the post-birth control syndrome. Coming off of birth control, there's a kind of a swing that has to happen in your body. Now, the better that can be managed is one of the things I love to work with women on. If it's managed properly, it can be very minimal. If it's not managed properly, so I never really suggest you just deciding today, like, I'm going to stop my birth control and just stopping it now and doing nothing else to prevent swings in hormones, swings in thyroid, swings in gut function, because those things are going to happen. If you've been squashing your hormones for years and all of a sudden you stop doing it, your brain has to figure out what to do from there, right? There's going to be a learning process. So there are always much safer ways to do it, gently supporting some hormone balance as you come off of the birth control. But even more importantly than that, before deciding to come off of it, making sure you are supporting your gut health, those nutrients that have been depleted, and your liver. Those are the 3 things in the beginning that are going to have to do the most work as we work to balance hormones and thyroid, right? So one of the things I do that is incredibly important is making sure that you're working through the right phase at the right time. So even if your goal is hormone balance, if all of these things over here are still out of balance, right? If we don't have the right nutrients, if your gut isn't working well, if your liver is clogged up, if there's tons of inflammation, you can do the best natural things for hormone imbalance. You might not get the change and the benefit that you're looking for because you forgot all of these root causes over here that are stopping your body from being able to balance hormones. Now, the great news is everything over here are all things that you can work on while you're still on birth control. You're not going to balance your hormones while you're on birth control. In fact, we can't even do a whole lot of hormone work until you're off the birth control. But all of this prep work is where the magic happens. This gets your body ready to be able to make the transition so it can be a whole lot smoother. So the 4 areas you really want your focus on, making sure you're getting good balance in your microbiome and your gut health, gently supporting liver detox. You do not want to do a giant detox. You don't want to do a forceful detox, but you definitely want to support gently how your liver can process those synthetic estrogens. You want to make sure you're repleting all of those nutrients, and then you want to make sure you're reducing as much inflammation as you possibly can. Those are the things you work on first. And then phase 2 is, all right, time to reduce birth control and start getting balance back into the hormones, the adrenals, the thyroid piece. All of that comes second. So really focus on that first piece first. And when you come off the birth control, move on. If you're already off birth control and you haven't done that yet, that is still your first step. You still have to go back. Gut, inflammation, nutrients, all of those things, liver, primary focus, and then hormones and adrenals. Ask questions about that in the comments. I will go into that process in a lot more detail next week, which things you do for that, what specific things for gut health, liver health. I think that will take its own chunk of time. So I will go over that process on our session next week. What I want to end with today is alternatives to birth control. Listen, nobody wants an unwanted pregnancy. I understand that sometimes, so I have women all the time, especially with teenage daughters, are like, okay, well, she's on it because the alternative also doesn't sound great, right? Like, I understand that. If it's for contraception, maybe there's a little bit of wiggle room. But for contraception specifically, we're going to talk about two different things. If you're thinking younger girl who is probably not responsible enough to do some of the other things I'm going to suggest today, or you're not certain that that will happen, the safer, not fully riskless, but safer form of birth control is going to be your copper IUD. There have been a few things in the past with like copper toxicity or having pelvic inflammatory disease from having the copper IUD inserted. A lot of newer research has been done and really shows that's pretty rare. And if I'm comparing the very rare potential that happens with a copper IUD to the very real, almost guaranteed side effects that you get from a hormonal birth control, I'm taking that one all day, every day. They also just recommend that you make sure you keep really close attention to your pelvic area within the first 30 days for the copper IUD, because typically any inflammatory symptoms will start showing up right away. It's not really something that tends to happen the longer you go. So you'll know pretty quickly if your body tolerates it or not. But when I'm comparing, again, if you're saying I need something that is in there that they don't have to think about, that is just, almost foolproof, mostly 99%, just like everything else, I would choose a copper IUD over a hormonal. However, still not my favorite choice, right? But I get that question all the time. I need something. What's it going to be? That would be the preferred choice. Better than that is to get really good at tracking your cycles. Every woman should know how to do this. And again, we're rarely taught. There's people now in their 30s and 40s who have to take courses because no one ever taught us how to track our cycles. This should be foundational information for every woman from the time she starts her period. But there's tons of extra help for that, right? So there's apps you can do. I do prefer like the thermoregulation techniques where you're tracking your basal body temperature, you're seeing when you're fertile, when you're not, when you're ovulating. There are tons of apps that help you do that, really easy and effective ones. And if you're doing it properly, then you should have it narrowed down to 6 to 7 days of risk every month, and then knowing when your safe times are. So that's the best way to do it. And then I'll have women say, well, my cycle's not regular, so that doesn't work for me. So my answer is always, okay, then our number one thing is we have to make your cycle regular so that the apps do work for you, right? Like that the alternative is not stay on birth control because you don't fit the app. It's fix the problem so that then you have a regular cycle, and natural family planning or tracking cycles will work perfectly for you. So if you have an imbalanced cycle, that becomes priority. But if you're someone who's like, I'm just not great at like remembering to do all that all the time or all the tracking stuff, there is a device that you can buy. It's called Daisy, D-A-Y, like day, S-Y, Daisy. And what it is, it's like a little personal computer. You take your temperature every morning and it does all the calculations and everything for you. It's one little device. It's super easy to track. It gives you your green window. It gives you your yellow window. It gives you your red window. It's really, really easy to follow. And it's less work that you have to do to track everything versus some of those apps. So if you know that you just need as much help as possible to make it the cleanest tracking, I really like that device. Or there's tons of free apps that you can use. You just have to put a little bit more attention into it. And then making sure in your window, when it's your not safe times, you are either using barrier methods, we'll talk about that in just a second, or you're abstaining during that window of time. But if you track well, and especially using that Daisy device that we just talked about, you get about the same percentage of safety that you do from hormonal birth control. You can get that 99% accuracy if you track properly, you know your body, you're doing it regularly. the same as you would with any other hormonal birth control. So I highly recommend, if you are not somebody who knows how to properly track your cycles, get an app, start right away, start playing with it a little bit over the next, couple of months and get really comfortable with that. And once you get good at it, you can get it down to a very clean tracking window, or use a device that makes it easier for you, like the Daisy one. Barrier methods are, again, effective as long as used properly. I know most people don't love them, especially traditional condoms. If you're sensitive to latex, the lambskin condoms are going to be your absolute best, but there are a lot of great, more natural fibers and organic ones. You are no longer just having the availability of your crappy latex condoms that are also probably full of chemicals and other junk that you don't want to use. So making sure if you're using a barrier method like that, number one, they're being used properly, right? Remember that the person putting it on is the one who's in control of that decision. So making sure that that's done properly, but also making sure you're using natural fibers. Use the lambskin, use the organic ones that aren't going to cause irritation or inflammation, whether you're using it the whole month long or you're using it just in your unsafe window, right? Your potential for fertility window, making sure you're getting a clean version of that. There are also more natural diaphragms. There's also vaginal sponges. There's lots of different barrier methods that if you get good at tracking your cycle, you should only have to use the barrier method 6 to 7 days out of the month. It's not something you have to do the entire time, but making sure you're combining the two and then getting really good at tracking your cycle would be very, very helpful. And then I just really, any of like the shots, the birth control, the hormonal IUDs, not a fan of any of those. There are a couple more natural kind of spermicides. One is called Phexxi, Fexxy. It's low toxicity. It's really not terrible at all. And it's something that the female applies before and has that same 99% efficiency as anything else. So if you'd rather be the one in control of that and that suits you better, Phexxi, Fexxy, that would be a different alternative for you as well. But there's lots of options that don't destroy your hormones long term, right? There's lots of options. And especially if you're on birth control for a non-contraceptive reason, if it's skin, if it's cycles, if it's hormones, if it's PCOS, if it's endometriosis, the more important thing you need to ask is, why do I have this hormone imbalance? Make sure you're identifying the hormone imbalance and then doing the right things to balance that back out. We'll talk about that chunk in depth next week, but remembering if you're on birth control or newly off, adding back those minerals and those nutrients right away, supporting your gut health, supporting your liver health, making sure that you're reducing inflammation. That's always step one. And I'll give you a great plan to do that moving forward. If you have other questions or other topics about birth control or hormones that you want to make sure I touch on next week, put that in the comments as well. I'm always happy to answer any of those questions. But I hope you learned some stuff about birth control today. I hope you're more informed. I hope you can share this information with others. If you're past that phase of life and you're not worried about birth control anymore, there are 100 million women in the world who need to hear this before being forced on birth control. Share that information with them. Educate yourself so you can tell others, because when we know better, we can do better. And we are in this moment, the way that it is, we are destroying women's hormones with the use of birth control as often as it's being used right now. And I think it's such just a heartbreaking thing that's happening in women's healthcare when there are so many other better options. So please share this, give people the information, and then come back next week and we'll do a step-by-step, what can you do for your gut health, for your liver health, and how to balance hormones coming off or to avoid being put on birth control. So thanks for being here, guys. We'll see you next week.